You did this very interesting and early study on where you looked at patients from Wuhan. And one of your conclusions was that 50 of those 54 patients died because they had ARDS, or Acute Respiratory Distress Syndrome. And that is really how the disease progresses to become lethal. So tell us about that and why wherever we are, should be worried about that.
Yes, so just to clarify, Govind, that was not my study. It was just a study that was done by Chinese researchers in Wuhan. And I was just analyzing it for the purpose of the audience, trying to explain what was happening. Okay. But you're completely right. So the people in that study were all hospitalized. So these are the severe end of the infection. They are not people who are at home with mild symptoms. These are severely affected. So they looked at the people who are in the hospital. And of the patients who were in the hospital, those who developed ARDS were much more likely to die. And what ARDS means, it stands for Acute Respiratory Distress Syndrome. That's what the ARDS is. And what happens is, as the virus goes down into the lungs, it causes the little blood vessels, you can think of them as the smallest branches of the arteries. It causes them to become leaky, and it damages all the alveoli, the little air sacs that are in the lung. And that kind of damage, if you look at it on a chest X-ray or a chest CT, it makes a normal CT or X-ray, which is black because there's all air inside it. It makes it turn completely white on both sides. And that is happening in at least some patients with in the pandemic. It is happening to those patients. And the patients that develop ARDS are the ones who are on the ventilator. And those tend to have a very bad outcome. Right. They tend to be the ones who don't survive.
Right, and the ARDS is really and there are is the ARDS also the reason why hospitals are only admitting COVID patients because they are likely to have ARDS?
Well, the hospitals are admitting people who have symptoms to the point that they cannot survive out in the community. So yes, they are admitting people who have severe symptoms. And some of them, the ones who develop ARDS, who get very, very short of breath, those are the people that need to be on a ventilator. So the point of being on a ventilator is not that the ventilator is curing the patient. It's just that without the ventilator, they won't be able to breathe. So that wall of the alveolus is so damaged with the ARDS that without a ventilator, those patients will die. So they need ventilatory support. You're literally pushing oxygen into their lungs, which otherwise